Hello everyone, I'm Dr. Nancy Stanley, physical therapist, life and health coach, and I'm here today to show you some exercises to help you if you have forward head posture, pain in your neck, maybe even headaches. So most of us spend a lot of the day in a forward flex position, holding our phone, working on our computer in our lap. I know I work at home, and you just imagine that if your head is a bowling ball, it weighs about 8 or 9 pounds, and it's on the end of a fishing pole, the pressure that's on the base of that pole, and that's what's happened with your neck. So statistics show that for every inch forward that your head goes away from the midline. So if I'm like this, my head weighing let's say 8 or 9 pounds, is sitting straight up and down on my spine. It's not really creating any pressure back here. But the further my head goes away from the midline, the more pressure is on the back of the neck and the spine and the disc and the ligaments and the joints, everything, okay? So I'm going to show you some exercises to reverse that. So it's not so much about the quantity of these exercises, but that you can do it often. So you don't have to do 100 of them, but if you could do, 3 to 4 minutes, maybe every hour. This is if you're experiencing neck pain, because it really is the culmination over time. That's what a repetitive stress exercise, a repetitive stress injury is. And like carpal tunnel, it doesn't happen in a week or two. It happens over months of overuse of those muscles. So I think you'll like these exercises. Share this video with a friend, because I think there's a lot of people in this position. All right, the first thing I'm going to do is I'm going to take a nice big thick towel. All right, and so you can do that too. I'm going to fold it like this, and then I'm going to roll it up really tight. Now this is something after you do this, you roll this big thick towel, roll it up tight. Now you're probably going to want to tape it, like just tape it, 2 pieces of tape around so it won't come undone, because it definitely will come undone. Or you can use a foam roller, but it needs to be one that's about 5 or 6 inches. I've got one in there, I forgot to bring it, but I wanted to show you what you could use at home. You don't have to buy anything. But if you have a lot of neck pain, you might want to just invest in something. But this, honestly, this will work great, and I've used it for a long time. Okay, so that's not the first exercise we're going to do. The first one we're going to do is, well, actually, the first exercise we're going to do is breathing, okay? So I'm down on my knees just because all of these exercises are down on the floor. But if you can't get down on the floor, you can do this on your bed. It needs to be a firm bed, or maybe if your couch is firm, I don't know. But if you can get down on the floor, this is great. So we're going to start with breathing. All right, so the appropriate way to do your deep breathing, hey Jenny, is I just did this over in the Swerve exercise group, so you might pick it up over there. Hey Pat, good to see you. Okay, so we're going to breathe in, and when we breathe in, we pull our belly button toward our spine, okay? And then when we breathe out, we keep pushing. We keep pushing to the very end, almost like we're trying to push part of our lung out. And the reason is because there's carbon dioxide down in the base of your lungs. And especially do this because of COVID, because most people end up with pneumonia with COVID, and they don't get oxygen down to the base of their lungs. And the reason is there's a lot of carbon dioxide. They don't use those muscles. So we're going to do 5 deep breaths. I'm talking, so I can't really do the exercise like I want to do, but you can do it. So here we go. You may be standing to do it, or you may be sitting, but you want to be sitting up straight, okay? So you're going to pull your belly button toward your spine, and then you're going to push out. In, and push out. In again, and push out. So you want to start with 5 of those. You're emptying that carbon dioxide out of your body. You're getting ready for this next exercise. So this next exercise we're going to call a floor slide. Now I'm going to turn my mat a little sideways just so you can see what I'm doing. But if you're watching this on the replay, just pause the video. Go get your big towel and roll it up, okay? Or your foam. A pillow won't really work. But because it needs to be good and firm because it's going to support your back. And you'll see what I mean now. So you're going to lay down on your back. You're going to put the end of this towel at the base of your head. So I'm going to poke it down in there. Actually, I need to bring it down some. Okay. And I'm going to lay across it. And I'm going to have that towel. I'm going to have the base of my neck, you know, that little occiput area, resting on that towel, but my head is not tipped back. I'm really more in a neutral position, and my shoulders are stretched out, okay? And from this position, we're just gonna slide our arms up over our head, and we're gonna call this an angel slide on the floor. So we're gonna just pretend like we're angels, all right? And we're just gonna raise our arms. Now you're not gonna hike your shoulders up towards your ears. You're gonna actually depress your shoulders. Now, I forgot to tell you the first thing. You're going to push your spine. You're going to tip your pelvis toward the floor. So your low back is pushed toward the floor. In other words, your back isn't arched. You've tipped your pelvis. And what that does is that incorporates some of those core muscles, okay? And then you're just going to raise your arms up. Yep. And while you're doing this, what's happening is gravity is stretching out your anterior muscles, okay? All right, so let's do 5 of these. This is 2. And you just want to take your time and do this. Again, pushing your belly button toward your spine, and you're going up and down over your head. Good. 3. Okay, we're going to go again. And push again. 5. Okay, very good. All right, so now we're going to come up, and I'm going to move back toward the wall. I'm going to come back this way, and this is what we're calling the sitting angel wings, okay? So we're going to, all right, I'm going to bring my elbows up, and then I'm going to reach up over my head, and I'm going to come back down. And now my belly button is pulled toward my spine, okay? I want you to remember that. All right, here we go. Up again, elbows up, reach up over your spine. We're going to do 5. Now you could do 10 if you want to. And again, you're breathing in while you're going up, and then you're pushing your air out as you go down. I'm talking, so I can't really do that, but we're going up, and we're going to touch our arms together over our head, and then we're going to bring our elbows back down. Slow and control. That's what Pilates is about. You're working through, you're not doing like this. You're doing it slow and controlled, because when you do that, you enable more of the muscle fibers to get incorporated. It's kind of like when you call people in the house to come help you move something. If you go ahead and start moving it, then they don't have time to get there. But if you wait on them and go slow at it, then by the time you're ready to move, they're all there, okay? So that's what we're doing. We're recruiting muscle fibers as we go. Yep. And reach up to the top, and then bring your elbows back down. Awesome. These are really good exercises. You know, I talk about, I'm 64 years old, soon to be 65, and, if I stop doing this, then I'll get to where I can't do it. And so whatever you're doing, keep doing it, or maybe even do a little bit more. I was talking to a 77-year-old, signed up for my program today, and she said, I ride my bike. And I'm like, yeah. She said, because I want to be riding my bike when I'm 85. I'm like, of course you do. And I want to be doing handstands. I want to be doing these exercises when I'm 80 years old. But if I sit, I remember watching my grandmother. She died at 84 of a stroke. But watching her lay on the floor and do her leg kicks at 80-something years old. And she would work her arms and all that. She knew that that was good for her to stay mobile. Okay, all right, so that was the third exercise. So we did breathing, we did the angel wings, laying on our back over the towel, and now we're about to do what I call Superwoman, okay? So you're gonna lay on your belly, okay, and your sun's about to come into this room really bright, okay, and you're gonna touch your nose to your mat or whatever you're laying on if it's the bed, and you're gonna put your arms over your head. If you can't get them over your head, then start to the side. Do them, you know, but we're gonna lift is what we're gonna do. So if you can, do it here. So you're gonna lift your arms and your head. Let's do 10. 2, 3. Remember you're breathing now. In, slow, and down. Blow it out. All right, if you need to bring your arms to the side, that's okay. Up, breathe in, and blow out. 5, here we go, up, and blow out. Over your head if you can. 7, and blow out. 8, and blow out. 2 more. Last one, and blow out. Okay, now what you could do is you could stop this video and play it again and go all the way back through those exercises. Or if it's a work day and you're working, you could just do it, you know, briefly. You don't have to go through the whole thing. But anyway, that's it for tonight. So here's what I want to ask you. Is this something that would help you? If it is, hit the like button. Just hit the like button or the love button, or make a comment like, I want to do this, or I enjoyed this, or something. And then share this video with somebody, because that's how this information gets out. But I appreciate you joining me, and let's talk soon.